Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Hi everyone, this will be part one of a two-part series on diverticulosis versus diverticulitis. Diverticulosis is the formation of small pouches of diverticula. I sometimes explain it to a patient by, if you look at a tire and it has those little out pouches, well, that's a diverticula. It's in the lining, of course, of the colon. And they develop over time due to increased pressure of the colon wall. It's often caused by low-fiber diet, long-term constipation, and, of course, poor peristalsis. Diverticulitis, on the other hand, is inflammation or infection of one or more of the diverticula. The diverticula become blocked with stool, or there gets bacterial in there, and, of course, infection ensues, causing symptoms such as abdominal pain, fever, nausea, changes in bowel habits. And diverticulitis, of course, is more serious than diverticulosis. But let's for a moment just look at the symptoms of each disorder. The symptoms of diverticulosis are typically abdominal pain or discomfort, usually on the left side, in the left colon, the descending colon. Often there is bloating or a feeling of fullness. There could be a change in bowel habits. There could be either constipation or diarrhea. And in some rare cases, there could be blood in the stool. Now, diverticulitis, on the other hand, occurs when the diverticula become inflamed or infected. And these symptoms are much more severe, and they include the following: persistent abdominal pain, again, usually on the left side. There could be nausea, even vomiting, fever, and chills. There could be changes in the bowel habits, again, such as diarrhea or constipation, bloating and gas, and again, rectal bleeding very rarely. Now, the question, of course, is how do we make the diagnosis? Because this is something that's much more common than you imagine that comes into our offices and into our clinical limelight. Well, medical history and exam is always the beginning to all types of examinations. By feeling and maybe feeling a tenderness over the left lower quadrant or into the middle of the left and the lower quadrants, maybe even some bowel sound changes, either hyper or hypo, may start to give you an idea something in the colon's not right. A more direct evaluation is either using a CAT scan or a colonoscopy where the diverticula can be seen straight on. But what I usually do is the history and physical, and I order 3 blood tests or 2 blood tests, such as a severity, which often in diverticulitis is going to be elevated because there is inflammation, and of course a complete blood count, which would demonstrate if there was a leukopenia or leukocytosis, which you would expect the leukocytosis or the elevated white blood count. In instances that this is coming and going or persistent, other than just the radiological structural test, I like the functional evaluation of sending the stool for a CDSA or a complete digestive stool analysis. On our next installment, we're going to look and discuss conventional versus natural treatment approaches for these disorders. In the meantime, for more information, you can contact me at drmitch@mitchghen.com. That's DRMITCH at Mitch Ghen, MITCHGHEN.com. As always, thank you for watching.